Me today. I'm very interested to hear about all the various backgrounds that everyone here is from. So hopefully this will be interesting. And I hope that I can answer your question about how many species have had COVID if you just start counting from the beginning of my talk to the end. So it should be in there, either mentioned at some point. We should hit most of them anyway. And I think that question depends a lot on if you're talking about natural infection or experimental infection. So it's actually a pretty complicated question. But I'm going to be talking today about natural infection, and I'm going to be talking about felid species mostly. So I'm going to kind of take you through the timeline that we've all been through in the last couple of years, but you're going to see it tonight from the point of view of a zoo veterinarian. And it's been an interesting time for all of us to go through. We've all put a lot of extra thought into disease, infectious disease, zoonotic disease, which is something as a zoo veterinarian I think about every single day. But it's been in a way kind of exciting to see the whole world finally become aware of zoonoses, and also the opposite way around, the anthropozoonoses. But it is something that we think about in a zoo and wildlife situation all the time, of course, and worry about our animals, as well as think about that as far as our staff and our guests as well. So we're actually going through that same thinking right now with avian influenza and all the other things that are on the horizon. Hopefully not monkeypox, but there's lots of talk of that, mostly in the media currently. But those are things that we deal with all the time. But this, of course, was a very special situation for every single person. This obviously COVID touched pretty much, every single life on the planet, human life on the planet. And in our zoo, we were initially closed down for the first 3 months. When everything closed down, we were closed down by state order. And then we reopened in the end of June 2020. But our jobs really didn't change that much, even though the zoo was of course closed down, because our care of the animals stayed the same. But then as the disease progressed, it actually became a little bit more interesting as we saw what species could get COVID. So I'm going to kind of talk you through kind of chronologically about what the experience was for us at a zoo. And every zoo in the country dealt with this that had susceptible species to COVID as it developed, and kind of what our thinking was and is and changed, and how it changed our work with many of these animals. So I'm sure many of you probably have heard the term One Health. It's also a term that has become more popularized and more familiar for people, I think, in the last 2 years. It's something probably most people had not heard about beforehand. It's something we deal with in our field a lot and believe in very strongly, but this is basically the cross-section of human health, animal health, and environmental health. So as a veterinarian that's trained in taking care of many species, as all veterinarians really are, we are very acutely aware of the intersection between animal health and human health. And as a zoo and wildlife veterinarian, environmental health is, of course, equally important. So those three intersections really have great bearing on something like a pandemic, and really came to demonstrate, I think, for a lot of the world how important each one of those arms are in this sort of situation. So if it had any benefit, I think the field of One Health has benefited from the tragedies of the last 2 years to make people, including government funding and grants and things like that, more available for this field. So let's go back to the early 2000s and go back to SARS-1. And the origins of SARS CoV2, or COVID, or the disease that causes COVID-19, remains unknown. So we still don't know the actual species that it originated in. It is thought to have originated most likely in an animal. The theories of it escaping from a lab are still not completely ruled out, but are thought to be unlikely. But most of that is just because it's becoming increasingly hard to prove that the further out we get from the origin of the disease in itself. But if you go back to SARS-1, it actually took many years to figure out the origin of this virus as well, but it was traced back to horseshoe bats in China and Laos as harboring very similar coronaviruses that were genetically so close that they feel now that it is proven that it was a rhinophilus species of bat. And for a long time during the SARS-1 outbreak, if you'll remember, the palm civets were kind of blamed for having spread this disease. And it was similarly, it originated, the thought was, in markets that were tested, and civets were commonly positive. So before the bats were definitively proven, there was a time when they were culling civets in China because they thought they were where the virus was originated from and how it jumped into people. So this is an article from Nature that it took actually until 2017 to prove this theory that the original SARS virus originated from bats. So if you just go back and think about how long that was, it was over 15 years that it took to prove that. And I thought this headline kind of summed it all up for the second half. As they prove the origin, you can see here, it suggests that a new outbreak could occur. And that surely did happen. So when SARS CoV2 originated in China, already in the very first weeks of the outbreak in early 2020, they were testing cats. There was a study that came out very early on of testing feral cats and household cats that were owned by people that had COVID-19 for the virus, and they were shown to carry the virus, live virus on PCR testing, and in some cases have mild disease. So we knew very early on that domestic cats were susceptible. And then there were initial trials, experimental trials in domestic cats, domestic ferrets, and hamsters, and other species, including dogs and some other animals. And it was found, cows were also some of the first ones, and pigs that were tested. And they found that these three species of domestic or lab animals were found to be able to carry and also transmit the virus to animals that were adjacent to them in cages. So, and the domestic cats and domestic dogs were shown fairly early on to be able to contract the virus from positive owners and to become mildly ill. It took a long time to actually show that. It's not completely proven, as far as I know, that dogs can really become primarily ill from the disease. So there are lots of reports that were flying around the popular media that dogs were becoming ill. Most of those cases, the animals were already very sick with another disease. Cats, however, domestic cats were shown to become mostly mildly infected. There's been very few cases of severe disease. So far, there have been, as far as I know, a couple hundred cases of domestic cats becoming ill. So if you think about the millions and millions of cats that were exposed around the globe through this pandemic, what are you going to do if you're sick and you're holed up in your house and you're under quarantine and you're not feeling well? You're going to be snuggling with your cat, who's probably going to be directly in your face, breathing in the virus that you're excreting. So from a very early stage, we knew about the cats, but we didn't really, in the zoo world, feel that cats were terribly susceptible, because otherwise we would have been seeing many more cat cases in domestic cats, because they were being exposed at likely very high levels. But again, we knew experimentally they could become exposed. An experimental trial of an infectious disease and a natural infection, as you can imagine, are very, very different. So if an animal is experimentally exposed, they're usually exposed directly. So most of these experiments were done with intratracheal installation of virus in extremely high levels. So the virus loads were many times higher than a natural infection. So the fact that the animals became sick from that is important to note, but it doesn't prove natural infection. So at the zoo here, we were mostly waiting for the natural infections and watching them very closely, because we felt that replicated much more closely what we would be dealing with in the zoo situation. So this paper came out in early 2020 as well. This was a paper that looked at the molecular makeup of the ACE2 inhibitor, and probably everyone has heard of this ACE2 inhibitor, whether we know what it is or not. This is the inhibitor, or sorry, this is the receptor that, sorry, this is the ACE2 receptor, not inhibitor, sorry, I'm misspeaking. So this is the receptor that the virus attaches to in humans. And so this is a receptor that is well conserved in most mammal species and others. And so this was an easy thing to look at across the different species. So this was an article very early that caught a lot of attention to people that work in the comparative field. And they basically summed up different categories based on the similarity of the ACE2 receptor to the human ACE2 receptor. And to the binding sites, they looked at, I think, 22 amino acid binding sites that the SARS CoV2 virus attaches to. And they did not look at location of the receptors, which became later very important. So if I remember, I'll get back into that with felids. But in humans, these receptors are mostly in the lower and upper respiratory tract, and they can be in very different places in the body in different species. So interestingly, the categories that were found lined up from what we learned later in some cases, and in some cases they did not at all. So I can kind of read you some examples. They categorize them in very high risk of developing COVID-19, high risk, medium risk, and low risk. And again, this is a theoretical paper based on molecular makeup only. This is not an infectious disease experiment. But the very high category, they had the old world primates. And that's something that we assume from the very beginning, especially great apes. We assume because of their similarity to humans and their ability to contract most infectious diseases, especially respiratory diseases that humans can contract. We assume from the start that they would be susceptible. We started taking precautions around our chimpanzee troop from the very first reports of COVID-19 before they even hit Maryland. That is not necessarily held true. So there have been infection or experimental cases in macaques, as well as clinical cases in gorillas, but there have been actually very few compared to the number of animals that there are in different zoos and sanctuaries. And none of the other great apes and no other old world primates have shown natural disease, interestingly. The high group included lemurs, as well as rodents, which you saw hamsters can be susceptible. So rodents is definitely a group that some rodents can contract COVID-19. Marine mammals, cervids, which we'll talk about in a little bit, that did come true in some cases, and anteaters of all things, which have not had disease so far. The medium level is sheep and goats, bovids, New World primates, and that's where the cats were. So the different species, domestic cats and non-domestic cats. So pretty far down in medium. And then the low group includes rhinos, camelids, canids, equids, ursids, and bats. So it's kind of interesting, to me anyway, looking at what we now know. We probably don't know everything yet. But again, it hasn't lined up terribly well. And now there's a lot of studies out there looking at the location of those receptors as being more telling. So our world changed in April of 2020 when the original SARS CoV2 virus was circulating in New York City and started down the eastern seaboard. And that's when we, of course, saw our first big wave that happened in Maryland. And that is when, and many of you probably remember this headline, but the Bronx Zoo had multiple sick tigers and sick lions in their collection. This cat was the index case, and she was kind of moderately ill. They did have to anesthetize her and treat her, which is kind of what we're considering moderately ill. The rest of the tigers and lions were mildly ill. They were never able to prove the source of the disease. They assume, and that's going to be the case for most of these zoo cases, they assume it was an asymptomatically shedding keeper. Most keepers, many keepers anyway, in this field are younger, probably in their 20s and 30s, so it would not be unexpected that they could asymptomatically shed. So these cats were all tested. They were all in the same building. They were taken care of by the same keepers. There were other cats in the zoo that were also tested that were not taken care of by the same keepers, and they were all negative. So this was really a wake-up call for all zoo veterinarians to change our thinking about susceptible species. So we went from thinking that cats were possibly susceptible to knowing that non-domestic cats would be. And at that point, pretty much every zoo in the country that had at least big cats, Panthera species, started changing their PPE and biosecurity. And we're basically then doing the same thing they were doing with primates, which was mostly masking and being careful about, traffic, and then also staff monitoring. I'll get into that a little bit later of what we've been doing for precautions, but we started putting up precautions and being very cautious around all of our cats. Following in the summer, as the original COVID strain started spreading across North America and was still causing issues in Europe, there were cases reported in lions, curiously, in multiple places, in multiple zoos in the US and in Spain that summer. And that was followed shortly after by a cougar case in South Africa, and then American mink fur farms in Europe. So they started in Denmark and Holland, and then cases were also seen in the US and several other countries. So I think this also, for those who are paying attention, it really brought to the forefront of how many fur farms there still are in Europe and North America. That was something I was not necessarily aware of. I knew there were fur farms. I did not know that it was millions and millions of mink. So through these outbreaks, there were literally millions of mink culled. The EU already had a ban in place, I think, for 2024 to end fur farms in the EU. And that was actually sped up because they basically closed all fur farms in Denmark and the Netherlands, which is where the majority of fur farms were in Europe. There were fur farms first in Utah and then various other states that were that had positive cases. And these animals were actually, I would say, moderately ill. So there were some deaths. There were some fairly sick mink, and then most of the fur farms that were affected were depopulated. There was also a case in one wild mink. So in Utah, there were studies done by USDA in animals, wild animals and domestic animals in the vicinity of these farms, and they did find one wild mink that was exposed. Around the same time, the San Diego Zoo had an outbreak in their gorilla group, and there was one older gorilla that became quite ill, again, probably I would say moderately ill, and had to be anesthetized several times for supportive care. The other gorillas were mildly affected. So as you can see, the cases throughout 2020 started to become more broad. So this changed our thinking quite a bit. Again, American mink are mustelids, so in the same family as ferrets, that were susceptible to SARS-1 and SARS CoV2. So the mink was not terribly surprising, knowing what we knew about mustelids. So this added to, at our zoo, the list of susceptible species. We started taking precautions around our mustelids, as well as our, in addition to our felids and our primates. So that was all basically the original strain, and then the alpha variant, and then everything changed. So Delta caused a lot of surprises, and really changed our way of thinking once again, just like it did in the human population. We've had to rethink this virus over and over. So the Delta variant, as you remember, started in India, and near the end of the Indian wave, there were cases in a zoo in India that was somewhat well proven. It wasn't 100% confirmed, but it was fairly well proven in the manuscript to be caused by the Delta variant. And that was followed by, when the Delta variant started affecting Europe and North America, it was followed by many, many zoos and sanctuaries reporting cases in lions and tigers, mostly. Again, very interestingly, up until then, it had been all Panthera species, and it continued to be Panthera, so the big cats. That was followed by cases single cases in jaguar, snow leopard, further cougar in a couple of cases, so a couple of other large cat species. These continued to be mostly mild cases, although with Delta, some of the cats became very ill. So it started to cause moderate disease in some of these cats that needed quite a bit of supportive care. And it seemed to kind of mirror the situation in humans. So they were the older cats that had underlying disease seemed to be more affected. Younger cats seemed to have mild disease or asymptomatic disease. And then we started to see some further surprises that we had multiple cat species, including small cat species. So there was a case in the Brookfield Zoo in a fishing cat, a case in a Pennsylvania zoo in a Canada lynx, pictured here. And then we were seeing outbreaks also across the zoo. So at the Brookfield Zoo, they had a case far across the zoo that was unrelated to, not the same keepers taking care of the animals. There was a fishing cat on one end of the zoo and a coati on the other end of the zoo. So that started raising, a binturong, I believe. So that started raising flags again, that as we knew, Delta was much more contagious, but it seemed to be also affecting different species. The binturong was also the first vivarid. So that's in our zoo, we added the vivarids to our list of susceptible species that we were being careful with. Around the same time, there was a report out of the Georgia Aquarium that Asian small-clawed otters were sick. This is a picture from their press release of an otter with upper respiratory symptoms, wheezing and coughing. Like I said, there was a coati, and then the Denver Zoo reported cases in spotted hyenas. So this is, you can see the family list is getting longer at this point. And again, curiously, you don't see them adding primates to this list, right? So there were the Georgia case, or there were the San Diego Zoo cases, and then the Atlanta Zoo reported cases in gorillas as well later in Delta. So, but again, we were still pretty surprised that we weren't seeing broad cases in great apes. So we were taking the same precautions in zoos with the cats and the great apes, and we were seeing breakthroughs despite all of our biosecurity, despite, you know, wide vaccination in staff, lots of masking. We were still seeing these cases break through. And then the next surprise, which I'm sure many of you have heard about this as well, is the virus was found in wild white-tailed deer in multiple states through surveillance efforts by USDA and some of the states. So this is, there are a number of states, including also provinces in Canada, that have had high prevalence in white-tailed deer populations. And this is, initially it was antibodies, and then it was also PCR and live virus that was found in the deer. So there's a lot of discussion right now what that exactly means, if they're harboring the virus, if they are creating the next variant, if it is circulating in deer and they stay in deer as a host and could go back into people. There's lots of questions about how the deer contracted the virus, since there isn't really that close of contact across the board to most deer as far as humans coughing on them. Like, you know, when you think about close contact to cats, sure, or a zoo animal, sure, but a deer is not typically going to allow you to be close enough that you would be within that social distancing range. So there was a lot of talk about whether it could be ingestion. That hasn't been proven in any other case in humans with COVID. So that's, I would think, unlikely, but we still don't really know. There are also positive cases in mule deer. So just adding to that list. So we have a lot of deer in the zoo. So this was also not something we were super excited about, knowing that it was a potential. And then in late 2021, we had the first really serious, shocking cases in snow leopards and lions. So there is to date one lion that died of COVID-19, and we're up to 5 fatal infections that were associated with COVID-19 in snow leopards. These were in different zoos. The cases were not all shown at necropsy to be primary infections. So the cats did not all die of actual COVID-19 respiratory disease. Some of them died of secondary infections, but they were all associated with the disease. So several of the snow leopards actually died of fungal pulmonary infections. So we're still trying to figure out exactly why that is. But the immune response mirrored what we're seeing in people that die of COVID-19. So they had the ground glass appearance in their lungs. They had the storm of mediators that you see in human disease. So the the immune system response that is the exuberant immune system response that causes all these kind of secondary symptoms with COVID when people get really, really ill. So they were basically like an ICU case in a human. And they succumbed in 6 cases now. So this was, again, a time when there was a huge amount of biosecurity in zoos. Everyone was being very careful. Everyone was masking around the animals. These were also all unvaccinated animals, but mostly being taken care of by vaccinated keeper staff. So, but as we now know, you can of course still carry COVID even if you're vaccinated. So somehow these were all cases that slipped through despite all of our care and guidelines. So I'm going to talk a little bit about what it's like to work in the zoo around these cats and these other susceptible species in the last 2 years. So like I was saying, we started masking very early on. We start around the primates and then expanded that to felids and other species. And masking, of course, around ourselves for the first, we're in Baltimore City, so we were under a mask mandate until August of 2021, and then back under a mask mandate under Delta. That was actually just lifted not very long ago, 2 months ago. So we, around the animals, we were masking initially with cloth masks, trying to preserve, the better masks for the human health area. We actually donated a lot of masks initially to Hopkins and some of the other local hospitals that we had here at the zoo initially, several thousand masks. So we were working with cloth masks only, which, we know now and also then that they are not as good as a cloth mask, and of course not as good as an N95 mask. We were also masking, and we still have our nutrition staff masking when they prepare diets, because we're still not completely sure that cats especially could not get the disease from, for example, a person coughing on their food. Again, based on what we know in humans, we don't think that's likely, but we are being extra careful in that regard. We put up a lot of barriers. You can see here, this is one of our keepers working with our female lion. She's doing a training session. So for a long time, when we became aware of these cases in cats, we actually stopped training. We stopped a lot of close contact with the cats. Obviously with cats and primates, you're going to have a barrier between you and the animal anyway for safety reasons, but we do a lot of training with these species ongoing all day long. So we really cut down on the number of staff in areas. We stopped initially doing any routine examinations from a veterinary side of things. We postponed all of their routine exams. We have obviously reinstated those because we can't let these animals go for years and years without veterinary exams, but we're obviously doing emergency and sick exams, but not anything that wasn't absolutely necessary. We put up barriers for guests. You can see on the left-hand side of this picture, there's an extra barrier to keep the people 6 feet away. I mean, with cats and primates, these are, again, dangerous animals. The public doesn't typically come that close, so they don't come within 6 feet of the animal ever. So that was somewhat helpful, but we did have extra barriers up initially. We had a mask mandate for guests in the zoo for a long, long time as well. And like anything in the beginning, like all of us, we thought this was going to last for a couple of weeks, and then we thought it was going to last for a couple of months. And then at some point, when it became clear this is going to last for a long time, just like in our daily lives, we had to figure out a way to work despite the virus. So we did reinstate training sessions, and we did reinstate routine exams in these animals, but we're trying to do this work, especially in very close contact, like when we have to anesthetize an animal and work on it for a long time. We have tried to do it during times when there's low community transmission. So for the last month or two, we've stopped again. Now we're restarting. During Delta, we had pretty much stopped except for emergencies for these species. We've opened back up the barriers for guests. So we do allow guests behind the regular barriers now instead of these extra barriers. We've lifted mask mandates for guests in all areas of the zoo now. We were kind of doing it in stages for a while. So again, with the caveat that we could reinstate them again at any point, but we have upgraded the mask quality, especially during Delta, when we saw these cases around the world happening despite all of the precautions that we were also taking. And we started having keepers and veterinary staff wearing N95s or KN95s around the cats and the primates whenever we were in this kind of close contact. So The staff also, we enacted a vaccine mandate in January of 2021 in the zoo. So we had about 96% compliance before the mask mandate in the zoo, which was really great. We had pretty much almost 100% compliance among the animal staff. And the mask mandate got us up to 100%. So, and we currently have something, I think, over 90% boosted. So we have really good compliance among the staff, which is really helpful. We have really great staff that are always really compliant. They're very used to dealing with, different diseases in the animals, things like tuberculosis. We do routine testing in the staff, and everyone is rabies vaccinated that has close contact with animals in the zoo. So people are very aware in the zoo of diseases, and we had really great staff buy-in for this, which is of course really, really important in our kind of situation with the number of staff that we have in the zoo working with animals. And then we also have been doing very close staff monitoring. So we have protocols in place. If anyone is showing respiratory symptoms or any symptoms of COVID, they have to go out on leave and be tested. And if anyone at this point is showing any symptoms, we've lessened that a little bit to make it a little bit easier so we don't have too many staff out with Omicron, since it was so much more impactful for staff. We now have a 5-day isolation, or if they become infected, in a 5-day quarantine if you have signs, and you have to get tested, and then you can return with a mask, with an N95 mask. But we don't let those people work around the susceptible species for at least 5 days if they were exposed, and 10 days if they were infected. So, and then we also do things like if the staff had some kind of high risk event. So if someone travels at this point on an airplane, or I just went to the Paul McCartney concert on Sunday, so I put myself under a 5-day mask mandate, and I'm not working with these species until Sunday. So if anyone, at this point, for a long time, we were trying to stop people from traveling or doing things, and that I think at this point is not as reasonable. So we're trying to make it doable and make it reasonable so we don't stop people's lives, but that we still get good compliance and people report it. So if someone feels like they had a high risk activity, like if they went to a conference where there were people from all over the place, or they were on a plane without a mask, like that's okay, but then be honest when you come back and take precautions. So those are some of the things that we've done, and that continues to change over time. We've also looked at building engineering. So we have increased ventilation, and we've actually installed UV sterilizers in several of the duct systems in the zoo. And we've actually done some testing, some air testing, to see if that's had an effect. It looks like it is having an effect in some areas. This is our Amur leopard. This is what training looks like for her. So you can see both the staff are masked, and she's outside as well. So we try to move anything we can outside. All right, so there is now an animal vaccine. So we're very excited about this. It actually just arrived at the zoo in the last 2 weeks. So we're getting ready to start vaccinating our animals. So Zoetis, the animal health company, created a vaccine for American mink. And in our field, that's kind of how this works. So we don't really have any medications that are made for the animals in the zoo, because there just isn't a market for it. So there is no pharmaceutical company that's interested in doing a medication trial for an elephant, because there's only 100 of them in the US or something. So, and as the species get more rare, it gets harder and harder. So we don't have any financial incentive to test any of the drugs or vaccines that we use in our animals. So when Zoetis, or when any company brings these vaccines or drugs out, they're always made for other species that there are a lot of. So there was talk initially to create a domestic cat vaccine. USDA decided that that was not a priority for the companies, because, as we were saying, domestic cats do not seem that susceptible to it to warrant vaccination. But the American mink and the fur industry seemed that that would be a way to, a viable reason to create a vaccine. And Zoetis was kind enough to reach out to zoos and offer this vaccine. They've actually offered it for free to zoos and sanctuaries in North America for vaccination of species that each zoo or institution feels is susceptible. So that decision is based off of what the veterinarians decided. Each zoo has decided on a little bit different species depending on their collection. And those families listed are the ones that will be vaccinated: the primates, the felids, the mustelids, and the viverids. This is an experimental vaccine, so it has caused Zoetis a huge amount of paperwork headache. I think that's probably the most costly thing they've had to do for us. So each state has to be separately licensed for this vaccine or approved for this vaccine. USDA has to approve it on an experimental basis for each zoo and state, and then the state veterinarian in each state has to approve it. So this has gone out in 4 different batches. Initially went out just to San Diego, who trialed it for their gorillas when they got sick. And then there were 3 other batches, and 41 of the 50 states were in this last batch that just went out in the last couple of weeks. So yeah, so we have this vaccine currently in the fridge, ready to give. The tricky part about this is because it's made for mink, this vial that he's holding up there is a 10-dose vial, and it has no preservative in it. So that's fine if you're in a mink farm and you have hundreds and hundreds of mink and you go down the row and you vaccinate each mink. That is, let me tell you, very mind-bending if you're trying to vaccinate all of the animals in a zoo, because we are also doing this mostly with voluntary training. So we have been training for months to get all of our chimpanzees and our lions and our leopard and our cheetahs and our otters and our badger ready to accept this with training and through the mesh, so with protected contact, as we say in the zoo world, to voluntarily stand, press their hind ends up against the mesh and accept a mil of this vaccine. So trying to do that, the vials can only be open for 24 hours. So we have to have everybody lined up to take this vaccine, and then they have to be able to repeat it in 3 weeks, which is also not simple to get the animals back in 3 weeks to train again for a second dose. In a zoo setting, we often dart the animals for vaccines or anesthesia, so that is always a backup. So we'll be ready in the wings to dart if we have to, but the keepers and our technicians have been working extremely hard to try and get this into as many animals voluntarily as possible. So we have it marked on the calendar for 2 weeks from now. So the vial is going to be opened at 10 o'clock in the morning on day 1. And we have 5 of our 14 chimps, or five lined up that are fully trained and are very reliable. So 2 of our veterinary technicians and our chimpanzee trainers are going to be working together to try and get 5 chimps, which, let me tell you, is not simple. It'd be lining up 5 kids and having the first 4 kids watch the others get vaccinated and then convince the 5th kid that it's okay. So they're obviously very, very smart. So it's going to be, we'll see how it goes with getting it into all 5 of them. At the same time, we're going to have another veterinary technician and keeper convincing our female lion that she should accept the voluntary injection. And then we have multiple animals lined up as backups. Then we're going to move on to the leopard, who is very, very compliant, the one that you can see at the mesh training with the 2 keepers. We're not too worried about her. We think she'll take it quite well. Our cheetahs are also well trained. And then our otters are extremely well trained, as is our badgers. So we have a bunch of animals kind of lined up on the alternate list if the chimps are not as cooperative. And then the next morning, we have the same chimps lined up at 9 o'clock. So anyone that doesn't take it, they have until 10 o'clock the next morning. So we're going to basically get 2 days out of it to use those 24 hours as best we can. So, and that all has to be repeated 3 weeks later. And then we'll open the second vial and try for the next 5 chimps that they'll then take 3 weeks training to try. Those are like the chimps that are not quite as convinced yet that will hopefully get trained as well. So it's going to be a big production. If they would have just put some preservative in that vial, it made our lives much, much easier. So, and we're also going to try and anesthetize our male lion, who does not enjoy voluntary training, to do a routine exam on him at the time of the booster in 3 weeks. So there's a lot of things to align to make this happen. And every zoo in the country has been through this exact same thing of trying to make the most out of every single dose, because it's basically gold for us to get them vaccinated. So that's the vaccine itself. And I want to talk briefly about a vaccine study that I've been involved in planning. So the Felid Taxon Advisory Group, which you maybe heard mentioned in my bio, This is a group of experts in the zoo and aquarium world. So within the zoo world, there are around 230 zoos and aquariums in North America that are accredited through the Association of Zoos and Aquariums. And those are kind of your, higher level zoos that have to abide by really strict guidelines. And within those zoos, we're the zoos that, and aquariums that swap animals and breed animals according to stud books. And each one of these species has its own stud book and group of experts that get together to decide breeding and health and where animals move to and how animals are, guidelines for care of those animals, safety, a whole bunch of things. And each one of those groups also has a veterinarian within the group that is an expert on that species that advises on diseases and comes up with these guidelines. So I'm one of those veterinarians for this Felid group, which is an overarching group of all the different species of cats that you see in zoos. And we initiated, when this vaccine came out, a vaccine study to try and at least collect some information on whether this vaccine is efficacious. So it was made for mink. It is a subunit vaccine. So it is similar to the Novavax vaccine that just came out. So it's not an mRNA vaccine. It's not a vectored vaccine, but it's a portion of the genome that is split out and then replicated. So the reason we're so willing to give this to animals across the board is that it cannot cause the disease because it's just a portion of the genome. So we feel very good about safety. There are other subunit and recombinant vectored vaccines that we use in the zoo world that have been shown for canine distemper, for example, that we've been using for decades that we feel very good about safety. So the safety of giving to different species is luckily not an issue. And so far we've seen no vaccine reactions in felids and only a couple of tired gorillas after vaccine. So very few side effects, less than in humans. And then what we'd like to look at here is antibody titers. So we've made a call out to all zoos in this AZA group, which is over 200 in North America, because many of these cats are so well trained, they're not only trained for hand injection, they're also trained for voluntary blood draws. So this is one of our cheetahs, and our veterinary technician is on the right, and you can see the cheetah is behind some caging, so they're not sharing space with it. The trainer is on the left, and she has a buoy in her hand. That's the target that she's getting his attention with and training him to hold. And there's a hole in the fence that the veterinary technician pulls the tail out of, and then the cheetah's trained to sit still. And then we actually bleed the animals out of the tail vein that is pretty easy to access. Obviously, this is the safest part of the cheetah to access, or the big cat. So if you have cheetahs are fairly easy to work with, but of course, if it's a tiger or a lion, you're not going to pull any body part out except for a tail. So they're often trained for this as well. And it's a great spot to get a small blood sample from. So there are many cats that are trained for this. So we're asking zoos to send us pre-vaccine titers so we can sort through whether the cats were exposed and infected or not before vaccination. Some may have been infected asymptomatically and never shown signs. And then also post-vaccination. So between the boosters and then out to 12 months later to see, at least to use one part of the immune response to see if we're seeing at least antibody titers. That doesn't prove efficacy, but we're hoping that it will at least give us an idea. So this only works for the big cats because the big cats are the only ones that have really long tails. So the small cats, this is pretty tricky to get it out of like a bobcat tail. But some places have sent us samples that they were opportunistically able to get when the animals were anesthetized in between these times. So we have about 250 samples that we just sent off to Cornell University, to the veterinary laboratory there, to assess titers that we should have hopefully in the next month to have somewhat of an idea. So we have seen a few vaccine breakthrough infections with Delta. All of them were very mild. So it's following also what we've seen in humans. We have had no reports of Omicron in any felid, non-domestic felid in the world so far. That could certainly change. But so far as I'm aware, we have not had any Omicron cases reported. We continue with the same precautions. Most places are keeping all of the masking precautions in place, whether the animals are vaccinated or not. But it is giving us some reassurance that hopefully they're not as at risk with, it's one more tool in our toolbox, just like for humans. So a lot of questions, just like we have in the human field with this. As the variants come through, it was very interesting to go through Delta and see how hard it hit the cats, and to see how Omicron seems to not be affecting them, and why we do not yet know. So we'll see what happens with future variants. We'll see how long the vaccine is effective. We don't have vaccine yet for boosters, so we'll have to see how that goes. And if it becomes a commercial vaccine, that would make things much easier. We'll see if we end up with some kind of wildlife reservoir as deer or some other species. And we still don't really know what the origin of the virus is. So that's something that's still being looked at. And then who knows what the next epidemic will be, right? Whether that is something affecting cats or some other species. So that's all I have. If you guys have questions for me, I would be happy to take them.
Wow, I don't know if I want to end on that note, because that's kind of a scary note, Dr. Bronson. If you can unshare, we'll come back together and see if we can do some questions and answers. But thank you for that. Any questions we have? Hold on. Let me make sure I get. Okay, I had to put a spotlight on you. Did that work? Yep. All right, everybody. Questions.
How can we help at home? Like spraying our shoes with alcohol or chlorine when we get out of the car, things like that, to not spread it to the wildlife or our pets.
I mean, I think contact should be a pretty unlikely way to spread COVID as far as we know now. I think really just taking all the precautions to keep the risk of contracting the virus low is probably the best thing that can be done. So being vaccinated, being up to date on boosters is, really, really important. I think masking in high risk situations, all the things that you would do to protect yourself will just lessen the impact of the virus on the susceptible human population, which will then hopefully reduce the number of animals that become susceptible, because these do appear, as far as we know, to be spillover infections. So we do think that they're all coming, at least initially, from humans. So with the zoo animals, so far they appear to all be spillover events from humans, and we don't think most of them are animal to animal. With the deer, it does appear that they're probably, in some cases, many cases, deer to deer. So I think just doing whatever you can to reduce your personal risk is going to help cut down on the virus and hopefully bring this pandemic to an end, or at least shorten the waves and hopefully get us closer to herd immunity someday.
I have a question. So there's no the virus originated from probably maybe a bat or an animal, comes to humans, then we're transmitting it to animals, and there's been no other animal that when they get it from us, do they give it back can they give it back to us? Can they shed the virus to us?
So there is documentation of that in American mink. So there was a variant that went from humans to mink in Denmark, and then went back into humans. And it actually caused a short variant in Denmark that actually for a time was a majority of cases in Denmark. They put pretty strict quarantine into effect to try and isolate it, and it actually subsided pretty quickly and did not go around the globe, luckily. So that has been proven. And I believe there may be a case that was recently reported in deer. I don't know how well proven that is. So it is certainly possible. I mean, the great majority is going from humans to animals. and stopping there as a spillover event. But we know from the mink case that it is certainly possible. And I think the big concern with the deer that scientists have currently is that we know that it went from humans to deer, but they do seem to be kind of cooking the virus. And so it is possible that they could create a separate variant within the deer populations. And we certainly know we have enough white-tailed deer that could then either go back into humans or just kind of sit there in the deer and not subside. So it could be a host that kind of harbors this virus and keeps the world from being able to completely get rid of the virus. So I think that's currently the theories anyway of the concerns with deer and then other species, right? We don't know right now what other species it could go into and do that same thing. So those are just still kind of theories, but certainly concerns, things to watch.
Well, it's terrifying. I'll just throw it out there. Again, because we don't know what we don't know. So there could be other species that have it, and we just don't know that they have received it. Is that correct?
Correct. Yeah, there's still a lot of surveillance going on. There's been a lot of surveillance that has happened though in the last several years. So I'm sure there could be further species, but I have to say, I mean, there's been a lot of good work done too. So I think we're kind of getting down at least to the main families that we think are affected.
And what about no birds?
No, it does not seem to be, I'm never going to say never, but no, it seems to be a disease of mammals. There are coronaviruses though that are not just in mammals. Most, yeah, so it's possible.
And in terms of pandemics or outbreaks, has this been unique amongst the zoo community, or did you have protocol in place to address a situation that would occur?
No, we actually have infectious disease outbreak protocols in place. So that's actually a requirement for this AZA, so our accreditation group, that each zoo and aquarium has to have an infectious disease outbreak protocol. So we have a template that we were able to pull up and use for this. But no, we are currently actually dealing with a disease that's affecting us much, much more, and that's avian influenza. So we currently have pretty much all of our birds inside at the zoo. So they've been inside for 3 months during the spring migration. And while there were cases nearby in chicken and poultry farms. So that's actually having currently a much bigger impact on the zoo than COVID-19. COVID-19, we're taking all of our ongoing precautions, but if you come to the zoo, you'll see the effects of avian influenza to a much greater degree. So for avian influenza, definitely keeping your shoes clean and being careful where you walk and things like that. So we're changing shoes all over the zoo. None of the staff or volunteers walks into the zoo with their street shoes. So yeah, we're always kind of, on the lookout for these kinds of diseases. West Nile virus was another disease that we dealt with in the early 2000s that passed from wild birds into the zoo collection, and then also, mostly in our bird collection, but also something that we were watching equids for, because it can go into equids. So yeah, it's it's something that we're well versed in. It's something that we try not to deal with and try to prevent in most cases. So we don't have cases of avian influenza in the zoo either. We haven't had any COVID-19 cases in the zoo, luckily, but we're trying hard to keep them out and to prevent it.
And the Dutch mink one, was that the only cooked up variant from an animal that's been found, or have there been other variants that have come out that have been tested? I mean, I'm sure that they're picking up, if any animal, they're going to see what variant is in there. Are there a variety of ones that have been discovered?
That's the only one that I know about. Like I said, I think there's a recent report and a possible human that got it from deer, but I think it was a case report, like one person. So I don't think it's anything that's caused a variant. So as far as I know, it's the Danish mink variant that was an actual variant. Never say never.
Well, yeah, they're clever little buggers, aren't they? They just try to they keep going on as best they can. So do we have any other questions for Dr. Bronson as we have her here? Raise your hand or put it in the chat box. You can raise your hand and unmute. We'll pop a question in the chat box. This has been a fascinating behind the scenes look of the effort that's taken place and giving us a completely different perspective of this pandemic that has been so much a part of our lives, but we've seen it now in a completely different light. And I think it gives us a different appreciation for the complexities that and the interconnectedness that we all share with one another and with our other species on this planet. So thank you for sharing your time and expertise. And thank you for all of the work that you do at the zoo to keep the animals safe and secure there. And it's a wonderful resource for our community.
Yeah, thanks for having me. Thanks for everyone for listening. Oh, and as far as I know, I think the number is 17.
Oh, Joe, did you guess that or did you Google it?
I guessed it. I did not Google it, but my count during the talk, doctor, was 28 during your talk when
Yeah,
I counted. So, but there, obviously you named some groups of animals, so that was probably at the low end and not the higher end.
Yeah, I think I
But
may have
thank
named
you.
some experimental as well. So those I wasn't counting, but per the USDA website, it should be 17. That can change tomorrow though, so.
Okay. Okay, well, that's interesting to know. That is very interesting to know. I should buy a lotto ticket then.
There you go.
Definitely go
but-
out and buy a lot. And everybody, I want you to thank you for coming.
Yeah.
And you all look a lot smarter than you did when you started off. And join us back to learn about Catfish of Maryland at our next Must Learn Thursday. I want to see everybody at Shark Fest coming up as well on the 25th of June. And stay safe, stay curious, and stay outside. Keep exploring. Take care,
Thank you,
everybody.
doctor. Thank you, doctor. It was very good.
Thank you.
Thank you.
I want to live in a zoo. It sounds safe.
You want to live in a zoo? Yeah,
It sounds safer than going to Walmart.
there you go. At least in Maryland Zoo, they haven't had any cases, so they're doing the right thing. Yeah. Have a good night.